Is National Ovarian Cancer Awareness Month, and ovarian cancer is the 5th leading cause of cancer deaths among American women, more than any other cancer of the female reproductive system. Joining us to talk about that and just bring awareness is Dr. Tiffany Woodis. Good morning to you, Dr. Woodis.
Good morning. Thank you so much for having me.
Of course. Where do we start? Can we start with the symptoms?
You know, that's a really good question, and it's one of the things that makes ovarian cancer so tough. The symptoms can be very common, very vague, and for those reasons often go overlooked. These are things like bloating, early satiety, meaning I feel full quickly. You can have changes to your bowel habits, changes to your menstrual cycle, breast, pelvic, back, or abdominal pain, and you can also have pain with intercourse.
Oh, wow. Dr. Woodis, what are some preventative methods that women can take to reduce their risk for this disease?
First, I want us to know our health history. We know that certain types of diseases that run in our families can increase our personal risk for cancer. So knowing that risk profile can allow your provider to develop a strategy for surveillance and prevention. I also want us to make sure that we're paying attention to healthy lifestyle choices. What does that look like? Don't smoke. Certain types of ovarian cancer have been shown to be linked to smoking. Make sure that you're eating a well-balanced diet and implementing regular exercise. Obesity has been shown to increase our risk for ovarian cancer, as well as the conditions that go along with not having a healthy lifestyle, like diabetes, hypertension. Those things in and of themselves can increase your risk. And then should you have cancer with those conditions, it can impact your prognosis, meaning how well you do with the condition and your survival.
Dr. Woodis, I had to do some reading up on this for myself, but Black women tend to present with more advanced stage ovarian cancer compared to others. Why is that, and what can we do to protect ourselves?
Great question. There are many factors at play here. The first is that Black women have less access to quality standardized treatment. Black women can sometimes also be subject to what we call social determinants of health, meaning that we're subject to food deserts or live in environments in close proximity to environmental toxins, or in neighborhoods where it may not be safe to get outside and get that regular routine physical activity, which can increase our risk for obesity and those comorbidities. We may also be subject to biases within the medical profession, which can mean that the signs and symptoms that we present with may be overlooked or disregarded, which leads to a missed opportunity to pick up things at an early stage and can make us present with an advanced stage disease. I want us to know that we need to be choosy about our providers. Studies have consistently shown us that when Black and brown people are cared for by providers that look like them and who are culturally competent, our outcomes are better. Be picky about your provider, check those bedside mannerisms, make sure that you know that you need to be an active participant in your healthcare, educate yourself so that you're not subject to what someone chooses to tell you about your health condition. Know that you can switch providers and you're entitled to a second opinion. Second opinions can save lives.
Dr. Woodis, before we go, I really want you to cover how Pap smear guidelines have changed.
That's a great question. It's one that many women are confused by. The Pap smear is for cervical cancer screening. It's not intended for ovarian cancer. So the Pap smear recommendations currently are that they start at age 21 and then they can be done every 3 to 5 years depending on your age and your risk profile. It's the pelvic exam that really allows us to look for ovarian cancer signs and symptoms, and that should be done every year despite these COVID times.
Wow. Dr. Woodis, as I said before we go, you need to get your information out there in case some women want to connect with you. I'll be waiting for you to give that information too, so I'm ready to go here.
Absolutely. You can find me in Cedar Hill at my new clinic this fall, on all social media at Doc Woodis and at WoodisOBGYN.com.
Dr. Woodis, thank you so much for joining us this morning.
Thank you.
You are a wealth of knowledge. Thank you so much.